So good morning everybody. Today I will be discussing about a very important program which is titled as Rmnch plus A. So the term Rmnch plus A stands for reproductive, maternal, neonatal, child health and plus adolescent. A stands for adolescent health. It's a very comprehensive program dealing with the most vulnerable groups in our many population. So what is the background to start this particular program? In the year 2012, Govt of India along with the UNICEF made one very important promise: global child survival call for action, a promise to keep. As a follow-up to this particular program, India launched the reproductive, maternal, newborn, child and adolescent health program in the year 2013. So this program is carried out by the Government of India with assistance from USAID, UNICEF, UNFPA and many other partners. So what you need to concentrate is a very important thing in the program is there are five pillars in this particular strategy: reproductive, maternal, neonatal, child and adolescent. So the emphasis of the word plus within this Rmnch is it also includes adolescents. In the earlier the importance of this plus is previous to this there was no specific program targeted at this particular age group, and this also emphasizes on the importance of linking maternal health to reproductive health, family planning, adolescent health, HIV, gender, preconception and the prenatal diagnostic techniques. So what is the aim? So any program will have an aim, that is the ultimate desired target that we want to achieve. For the Rmnch program, the aim is to reach the maximum number of people in the remotest corners of the country through the continuum of services, constant innovations and then routine monitoring. So in order to achieve this, the Rmnch has set up a particular target in the 12th 5-year plan. So what is the targets which are set? In the program we have set a target of reduction of infant mortality rate to less than 225 per thousand live births by the year 2017, the maternal mortality ratio to 100 by 1 lakh live births by 2017, and reduction in the total fertility rate to 2.1 by 2017. With reference to the targets for the reproductive, maternal, neonatal, child health and plus A program, there are certain targets, that is how much the program should actually cover in this particular time period. They have set up the target as the institutional deliveries. The The earlier target is to deliver 61%, and from this they want to achieve an annual increase rate of 5.6%. That is, at the end of the program, they have to increase 5.6% every year. The antenatal checkup, the coverage is 53% in 2009, and they want to achieve an annual increase rate of 6%. Postnatal care from 45% to 45% is the coverage, so they want to achieve an annual increase rate of 7.5% in the onset of the program. So with regard to the deliveries by the skilled birth attendants, who are the skilled birth attendants? The trained DAIs, doctors, and the coverage with this particular in the current status is 76, and they want to have the annual increase of 2%. Breastfeeding rates very low in 2009, that is only 35%, and they want to have an increase of 9.6% per year. And the program also hopes to achieve a reduction of prevalence of under 5 children with the underweight. So please concentrate. So all the other components discussed so far, they are focusing on increasing the existing value, whereas here the emphasis is on reduction in the prevalence of under 5 children with underweight. The next coverage target is to reduce the unmet need for a family planning method. So what is the unmet need? So unmet need refers to, it is that proportion of the eligible couple are people who should be using contraceptive, but for whatever reason they are not using contraception. The reasons could be many. So once again here the emphasis is on reduction of the existing value. Another important aspect of this particular program is to increase the met need. Increase the met need for family planning at a rate of 4.5%. So another important coverage target as far as this program is concerned is reducing anemia in both boys and girls by 6% every year, and then raising child sex ratio from the existing 91.4 to by 0.6% every year. So what is the strategy which is being followed or is proposed to be followed is, here the total number of districts are divided into high priority districts, and then the main focus is given on the high priority district. So in the focus in high priority district, the main emphasis is to address the interstate and inter-district variation. So what does it mean? So when it comes to the performance of any program, there will be a lot of variation between the states, and within the state itself the differences between the two districts. Then the programs which could be tailored to meet the needs of the underserved population, and it includes adolescents, urban poor and tribal population which are difficult to reach. Okay, so one of the important components of the Rmnch plus A is what is referred to as 5 into 5 matrix, which focuses on the 5 thematic areas. So in high priority districts, the emphasis is on the high impact interventions. So among the 700 plus districts in India, the program has identified that there are 184 high performance districts which need special focus with respect to the Rmnch plus A indicators. So this is the 5 important thematic areas which you should be focusing on. The main focus area, first one is the reproductive health, second one being maternal health, newborn health, child health, and then adolescent health. So under the reproductive health, the focus is on the spacing methods, especially postpartum intrauterine contraceptive device in high case load facilities, and then interval IUCD, that is if the IUCD is used as a spacing, device, and then home delivery of contraceptives. Then the next important aspect of reproductive health is to ensure access to pregnancy testing kits, and then strengthening comprehensive abortion care services. This is to ensure that maternal mortality reduced due to unsafe abortion. And then the next point which is emphasized in reproductive health is to maintain quality sterilization services. So coming to the next important thematic area, which is using MCTS. So MCTS stands for Mother Child Tracking System. So this is a web-based real-time updating system wherein all the antenatal mothers, postnatal mothers are tracked, and then the data is updated in real time. And under this, even there is a system of providing reminders for vaccination to all the eligible children. Next emphasis on maternal health is to detect high risk pregnancies and line listing, including the women who are severely anemic, and ensure appropriate management. So equip delivery points with highly trained HR and ensure the equitable access to the emergency obstetric services through FRUs. So this is very important. So at the delivery time, if you are able to ensure the availability of emergency care, it will go a long way in reducing the maternal mortality rate. And one more important aspect which is given emphasis in Rmncha+A is to identify villages with low institutional delivery. So in those villages where the number of institutional deliveries are less, so we have to motivate to ensure the distribution of misoprostol to select women during pregnancy, and to incentivize ANMs for domiciliary deliveries. The next important component of Rmncha+A is newborn health, which focuses on breastfeeding, home-based neonatal care, essential newborn care, and establishment of special newborn care units, and then community level use of gentamicin to treat infections in the newborn. So child health, of course, it focuses on complementary feeding, IFA supplementation, management of diarrhea, pneumonia, and then the focus is on full immunization कार्यक्रम, full immunization coverage. Rashtriya Bal Swasthya कार्यक्रम is a program for ensuring the child health. The new component which is added to this is adolescent health, addressing teenage pregnancy, increase availability of contraception to adolescents, and then strengthen adolescent reproductive sexual health clinics, and then roll out national Iron Plus initiative, including VIFS, WIFS, weekly iron folic acid supplementation, promoting menstrual hygiene. So these are the 5 thematic areas which are proposed to be carried out by on the foundation of the strengthening of the existing health system as well as the cross-cutting intervention. So the Rmncha intervention, to summarize, so the key implementation strategies as far as the Rmncha+A program is concerned is the continuum of care. So starting from the antenatal period, through the antenatal period, delivery, and then during the postnatal period, and then the continuum of care across life cycle and level of care. So starting from the clinical care, if you look at the reproductive care, the comprehensive abortion care is there, STIs and RTIs, reproductive tract infection, sexually transmitted infection case management, IUCD sterilization, and adolescent friendly health services, the then pregnancy and childbirth care, newborn and children, and then outreach services, family planning, STI prevention, antenatal care, postnatal care, early detection management of illness, immunization, child health care, immunization, and then micronutrient supplementation. At the family level, we have WIFS, that is weekly iron folic acid supplementation, providing health education on sexual reproductive health, family planning, menstrual hygiene, and then counseling, preparation of for breastfeeding, birth preparedness, and then home-based neonatal care, infant and young child feeding. So another very important addition to this particular program has been the adolescent health program, which is under which the priority interventions are adolescent nutrition. So here under this program, the main emphasis is given on the iron and folic acid supplementation. Facility based adolescent reproductive and sexual health services, providing information and counseling on adolescent sexual reproductive health and other health issues, menstrual hygiene, and then preventive health checkups. Under this, the regular clinics which are conducted, adolescent reproductive and sexual health program, that is in short called as ARCH. So as a part of that, routine health checkup at primary, secondary and tertiary levels on fixed days. And what are the approaches which are used for this ARSH? Facility based health services, counseling and community based. The main emphasis on ARCH is ensuring the adolescent friendly health clinics, which involves routine health checkups, provision of contraceptives, management of menstrual problems, RTI, STI management, and antenatal care and anemia. The second component in ARSH is facility based counseling services, and the here focus is on nutrition, puberty, RTI, STI prevention, contraception, abortion services, sexual abuse, substance misuse, and mental health issues. Outreach activities, many such activities are conducted in schools, colleges, village health nutrition day. Second important component is weekly iron and folic acid supplementation. So the main aim of this particular initiative is to reduce the incidence of anemia amongst adolescent girls and boys. The goal is to break the intergenerational cycle of anemia. That is, if the anemic girl grows up with anemic adult, gives rise to a low birth weight child, and the cycle goes on. In order to break this, they have introduced this particular program. So under this program, there is administration of supervised weekly iron folic acid supplementation, 100 milligrams of iron and 500 milligrams of folic acid. Another intervention is screening of the target groups and biannual deworming and providing the health education. Another important initiative in the adolescent plus year component is the menstrual hygiene scheme among adolescent girls in the age group of 10 to 19. So here the main emphasis is on community based health education outreach and regular availability of the sanitary napkins, distribution of sanitary napkins, training of ASHA and the nodal teachers on menstrual health, and then safe disposal of this sanitary. Other interventions with respect to this will be care during pregnancy and childbirth, newborn and child care, and care through reproductive. Other interventions in the Rmncha plus A is care during pregnancy, that is identifying high risk pregnancies, provision of skilled obstetric care, essential newborn care, and then provision of the postpartum care. Newborn and child care refers to home-based neonatal care, facility-based care, and then management of diarrhea, pneumonia, and malaria in IMNCI, child nutrition and essential micronutrients, immunization, detection and management of birth defects, care to the reproductive years, that is promotion of contraceptive services, ensuring the availability of sterilization services, RTI and STI prevention. In order to deliver this particular program, the Rmnch plus A has identified three levels of three delivery points for the service for delivering the care: the level 1, level 2 and level 3. So level 1 refers to that those hospitals which conduct minimum of 3 normal deliveries per month. Level 2 conducts minimum of 10 deliveries per month, including the management of complications. L3, it is like a tertiary care hospital conducting minimum 20 to 50 deliveries per month, including cesarean section. The main emphasis of this particular program is in strengthening of facilities to provide a comprehensive Rmnch program and to address the shortage, that is, as we all know, there is acute shortage of the trained manpower at the sub-centers as well as the tribal areas as well as in the remote areas. And another important objective of this particular program is to establish special MCH wings, maternal child wings, with a capacity of 30, 50 and 100 bedded units to ensure provision of emergency maternal and newborn care services as well as provision for 48. So how do you document this particular data which is collected during the Rmnch program is using health management and information system based dashboard monitoring system. It's a real time data which is updated, and the particular data is updated as and when new survey data becomes available. So what are the indicators that we can use? So whenever you conduct a program, you have to see whether we have been successful in achieving certain targets. So how do you know we have achieved the targets or not? For this purpose, we will use certain indicators. So for this particular program, we are using the following indicators. For measuring the mortality, we use the under 5 mortality, infant mortality rate, neonatal mortality rate and maternal mortality rate. With respect to fertility, we have the total fertility rate, births to women during the age group of 15 to 19 years out of total births, nutrition, child with birth weight of less than 2.5 kgs and nutrition of children less than 3 years who are underweight. So with regard to the gender, the main indicator which is used is the child sex ratio, cross cutting, full immunization of children 12 to 23 months, household having access to toilet facility, couples using spacing method. So when you combine 2-3 indicators, we can make a very comprehensive assessment of the particular program. With regard to diarrhea, proportion of children receiving ORT. With regard to pneumonia management, the number of children seeking treatment for acute respiratory infection in any healthcare facility. Service delivery, proportion of women receiving 4+ antenatal checkups, skilled birth attendants, mothers receiving postnatal care from health personnel within 2 days of delivery, early initiation of exclusive breastfeeding. So when you look at these particular indicators, please remember that the indicators are always used in combination and not in isolation. That means they are not supposed to be used individual indicators. Usually a combination of these indicators will give us a very good idea. So in today's class, I will try to summarize a very comprehensive program like Rmnch plus A. So because this particular topic is very important from the point of view of examination, as you can expect many questions from this particular program. Thank you.